I mean hemoglobin A1C. Okay, got that. So how about the others? How about Jane? So what do you choose? You choose fasting, right?
Yes, I choose fasting glucose measurement.
So how about the C-peptide? So why you don't choose C-peptide levels?
Because C-peptide levels is a way to distinguish between the type 1 diabetes and type 2 diabetes. So it's not necessary.
Really?
And it's also, mm,
Are you sure?
yes.
So how? As I actually for C-peptide level, they usually use to check to differentiate between the insulin omer and the fake insulin omer. Mean someone they inject insulin to their body to make the fake the number the value of the insulin the value of insulin, yeah, and the value of blood glucose. So the C-peptide value of C-peptide used for that. Okay, and mean like how can we check it? We check this. The C-peptide, like we said, is a secret from the pancreas. And this is for those of the we have the two way to check. We have the how can I say endogenous and exogenous insulin. So the insulin from the pancreas is mean like endogenous. You know endogenous? I'll write down. So I say something, but I don't know. I'm not sure you guys know about this word. Endogenous and exogenous. Yes, exogenous. Endogenous it means like from outside, from inside our body. It's the endogenous means from in our body and exogenous from outside. So C-peptide can help us differentiate between the insulin from the pancreas or the insulin from the outside we inject to our body. That's the meaning of C-peptide. Huh? So which thing will be increased, will be decreased? So for the endogenous, like the insulin come from our body when we check the C-peptide level. So how this trend? This will increase, decrease?
Uh, sorry, but I missed that part.
You miss?
Could you repeat it again? Yes.
I am asking like for the C-peptide when it will be the value of C-peptide in two cases will be so in the endogenous insulin the C-peptide will increase or decrease.
So for the endogenous and decrease.
And decrease, it will be decreased. And for the C-peptide in case of the exogenous decrease or increase.
For the endogenous, C-peptide will increase.
Increase. So what thing? The last option, what thing? Increase, decrease.
Increase.
Increase. Okay, so for endogenous we call it insulin omer hay là ưu tiết insulin. So the C-peptide will be elevated. So when we check the value of C-peptide, we will see it's elevated. When we check the value the C-peptide is decreased, mean patient don't have the insulin omer or the insulin from our body. They inject the insulin. They help us to differentiate. In some case, patient have the decrease of blood glucose but non-diabetes. They are non-done by diabetes. Họ không có bị đái tháo đường nhưng mà họ bị giảm cái blood glucose because they use inject the insulin to make the fat number. Have some patients have the thing like this. Not in Vietnam. I think it's not popular in Vietnam, but in those of countries like developed countries, they are so acknowledged. You know, lots of things. They can make the fat value when they want to bring the wrong diagnosis for the doctor because they for their purpose. You guys know about this? I'm thinking I'm talking about something so new. So do you know about the list words? You can check this word too. You can check this word fictitious or malingering. You can read about this thing. This let me hit this. You can check these words. So CBAP can help us to differentiate these words. This is the card disease like this. Malingering, giả bệnh. Okay, so for so we have two side here. So group one chooses the fasting glucose measurement, the other chooses the hemoglobin A1C, right? We have two group divided into two group. So okay, so I want to say the answer first, and I will discuss about this later. So the option here, the correct answer here is the fasting glucose measurement. So why we choose a fasting glucose measurement instead of using the hemoglobin A1C? Because sometimes we know it's really accuracy, and they use a lot in the hospital, right? But we need to know about why we will use it and why we cannot use it. So here the test, the information for today. And for like we say how can I say the benefit for every test here. So the random glucose we use it to check the number of the level of the glucose, like the range is at 200, so means it's less than or over than. And we check it when the patient have the symptoms of diabetes. So okay, tell me about your symptoms of diabetes. I think you guys know about this, but in English, tell me about it. The symptom of diabetes. Check it if you want. Thuong?
Well, the symptoms of diabetes are, like increased thirst.
Thirsty?
Yes. Increased urination.
We call this a polyuria. We call this a polydyslia.
Yeah, and usually hunger.
Hunger.
And gain weight.
Gain weight. Yeah.
Like
I think they have group of 4 symptoms, a typical symptom for diabetes patient. When they say drink a lot, they have the name. They say polydyslia. This year, they are eat a lot. They are urine a lot, and this is polyuria. And also, like they have the last one. They say weight gain or gain weight or whatever. And this is a first typical symptom for diabetes patient. So it needs to have symptom for that. Check the random glucose. For fasting glucose, what we will do? We can have check the pre-diabetes, and we can have the range is less. This is the less of the range of the level of glucose is reduced, because the number of the value can be will be limit more than this for random glucose. And for fasting glucose, we have to ask patient fasting at least 8 hours before we check the blood glucose, and need to confirm 2 times. But why we can use for this patient here? Why? Like Nguyen said, I agree with Nguyen. Like it's a convenient. Actually, it's convenient. Why? It's convenient because like we usually the patient comes to see us early in the morning, but if they want to check blood glucose, they should fasting at night time until when they go to the hospital, they can check it, or clinics you can check it. And moreover, they are cheap. It's cheaper than SbA1c. And the really important thing here, they use for screening for diabetes. Used for screening diabetes, because they ask us about appropriate screening tests. They are not ask us about the test used for with the go ahead.
I mean that we just need the screening test, not the diagnosis test.
Yes,
So yeah, we should make it kind of convenient and the most cheap,
yes,
the cheapest for the patient, right?
yes, yeah.
Yeah.
Yeah, that's true. Huh? That's we are asking about a screening test. Huh? They didn't ask us about the diagnostic test, the outer confirmed test. You clear about the question? Like they ask appropriate screening test. So screening test it needs cheap, convenient, effective, easy to do it, right? For the XBA1C, they have to at least you have to the examine. How can I say the test lab test, huh? Right? Right? They have lab tests, huh? They have to check the blood and they give the lab test, they check the blood glucose, they deliver it in. So they can do it in clinic or this the hospital. Maybe hospital more than clinic, I think. Because in the hospital they will have the machine, they have the lab test, they can do it. But in clinic maybe we don't have. So they ask us about the screening test. Screening test means when we said this is cheap, effective, and it's easy to take it. Okay. Mm-hmm. But I want to tell you like about the SPA1C. Huh? That's really accuracy test. Accuracy means like they can demonstrate the number of the glucose combined with the hemoglobin, and they cannot change. They cannot affect with those of things like we eat, how you eat in the morning, or what you are fasting or some kind. They don't care. They just know. They just care about the it will be consistent, huh, for the number of blood glucose combined with the hemoglobin, huh? Glucose combined with hemoglobin, and this is greatest for to give the diagnosis, confirm a diagnosis. And for XBA1C, you have to repeat the test after 3 months. When you give the patient have the diabetes, you repeat the test. You check the test after your treatment. Huh? You can treat with the lifestyle modifying or medication, whatever. But you have to check the XBA1C after 3 months. Okay. For the 2-hour glucose tolerance test, so what is it? They give us the information here. They give the range of this, and we have to can indicate when the patient have pre-diabetes is a founding on fasting. Like when you see the patient fasting, we check the fasting, we see the pre-diabetes, we can check with the 2-hour blood glucose, a tolerant glucose. Okay, just the meaning of the test like this. Actually, the test is not really easy to do it, or it's not much convenient. You have to ask patient drink the glucose after 2 hours. You check it again. Sometimes patient busy. Sometimes they don't have much time to spend stay in the hospital like this. So, like you have to do the other things. So it's not really effective test. Just like we tend to confirm again. Okay. So for the last choice here, urine glucose measurement, it's useful test for diabetes, but it's not for screening test. Like we talk, and it needs the glucose have a lot in, like it's the level of the glucose really high. Maybe in that time we will see glucose in the urine, right? It needs high glucose and it needs long term, like they can destroy the kidney membrane. Glomerular cái cầu thận, cái màng đáy cầu thận, membrane, basement membrane is destroyed. The glucose molecular they can escape from the membrane basement and they go to the urine and we can check it, because normally the weight of the glucose is 118. It's the big size for the membrane, the basement membrane. Chị nói các bạn hiểu không? Okay, you know nhiều quá hả chị? Okay, so those are things we can have the discharge. But C-peptide is used for differentiate between the insulin homer or the exogenous insulin we use for the patient. Sometimes like when we they want to make the fake insulin homer or some kind, just for the purpose. We don't know what the purpose. So the purpose is malingering. Any question?
Yes, I have a question.
Yeah, go ahead.
Yes, can you take back to the case? Yes. Um, I wanna explain a bit why I choose HbA1c. I don't wanna. Okay. Because oh, in this case, the first case, can you take it back to the first case?
Again, can you ask me again?
Or can you take it back to the first case? I wanna see.
Yeah, okay.
Yes. Okay. Because the woman hasn't been diagnosed. That's not because she don't have the diabetes before. So she comes to the physician for her biannual physical examination. Sorry. So maybe she hasn't fasting or yes. So if she have the breakfast before, so it can take her 3 days to do the test twice, right?
So you mean if you do the fasting, you need 3 days?
Yes. Because we have to do it twice.
Twice?
Yeah.
Twice mean like we need to confirm the. Yeah, we need to do twice at least. We need to confirm that. So you mean this it might take more time?
Yes. So I want to emphasize the word appropriate. So I just don't understand. It may if we do the HbA1c, we can save time for the patient.
The key thing here, I will not talk about how we implement the test. I'm talking about the screening test, like because why we need to choose the screening test for the patient, because those of the reason I told you. And for the HbA1c, they didn't suggest us to give the screening test, and they give us like the follow-up or the monitoring the glycemia, monitoring like we check it after we confirm the patient have the diabetes, and after that we check the HbA1c and we monitor them. Monitor mean like we follow up or some kind of that. For give the HbA1c for the first time, and actually in this case patient come to see the physician, and for me, I think it's a clinic, huh? So first, we don't have enough equipment or some kind of to do HbA1c. The second, like just they ask us about a screening test. So the screening test means they want to specific the thing, specific
Okay,
things. Like I'm sorry.
I got it. Thanks.
Yes.
Sorry, let me say something.
Okay, go ahead.
Okay. I think that's the most important thing of the screening test is that we can kind of find out the disease in an early stage.
Yes.
Yeah, and you know that the HbA1c will not really change in about 3 months, right? So
yes.
Yeah. So
okay, that's also the point. Yeah.
Yeah. If
yeah.
the HbA1c, we may kind of miss the disease
negative value.
Yeah. And also, you know, we also have some scientific papers that's published. I read on UpToDate.
Yes.
The specificity of the HbA1c is quite lower than the fast glucose measurement. So
for about a common value, like they have to have the gap. This right?
Yeah.
Can be, but I agree with you. Like, the value of the HbA1c in the first time, very early stage of the diabetes is not really is demonstrate, because sometimes it can give us a negative value. So sometimes we think patient don't have diabetes, even patient have pre-diabetes, lot of things. But pre-diabetes, sometimes we cannot see the increase in the number of the HbA1c. That's very important. But for fasting glucose, we can check the pre-diabetes.
Yes, exactly. And
yeah.
And physicians often do the HbA1c first when the patient have some kind of retinopathy kind of nerve regions. if they think that the patient already had the diabetes and have some kind of some kind of the vessel disease, so they will do the HbA1c first. But this patient have no symptoms, so it's not recommended for this test.
Yeah, I agree with you too. It means like the patient have complication of diabetes. The
Yeah.
complication, we have three things here. We have the retinopathy, we have the neuropathy, and the last one we have is nephropathy.
Yeah.
There are three. Three. I will send you. I will write down here. Yes, I agree with you too. Neuropathy. We're concerned peripheral neuropathy, and this is nephropathy. Okay, so this is three complications for diabetes patient, and I totally agree with you. When the patient have those symptoms for complication of diabetes, so HbA1c is an excellent choice in that time because it will be increased, totally increased. You cannot deny that. But from series first day of the diabetes, like I talk with the pre-diabetes, so for the fasting glucose measurement is effective, more effective and more accuracy, because sometimes we don't miss the case, we don't want to miss a case. But in reality, most of the time doctor recommend using the HbA1c because it's convenient for them. They don't want to wait. They don't want patient go away with them, and sometimes they just order the test HbA1c for everyone when they go to the hospital to check the diabetes. Right? I'm true. Am I true? I don't know, but I know like I always read the test from the hospital when they order. They usually start with the diabetes HbA1c first. They rarely use it. Rarely use fasting glucose. Right? I don't know too.
Maybe
How about you guys? Know about the practical clinical?
Sure, but I think that's mostly this is the patient who have some symptom of diabetes, like some cardiovascular disease or something like that, kind of some.
So how about for a general checkup? Like nowadays, really popular, right? They buy the package of the general checkup.
Routine checkup. Or the patient.
Routine checkup. Yeah, routine checkup. Oh, that's not routine. Yeah, can be, or they call it the name like general checkup. It's okay too. Nghĩa là khám tổng quát. So mean like just come to see the doctor and please do some tests for me, and they order HbA1c. I guarantee you they will do it. They will do it. Start with this first. Right?
You think that is right?
Yeah, this is a really usually popular here. No, I'm from my perspective. So maybe it can be changed in different city, different location, or different hospital. I don't know that. So it's from my perspective. Okay. So don't worry about it. We need to know what the value of the test, when we use it, when we cannot use it. And when we use it, what we can miss. Sometimes we can miss. So those of patients with early stage of diabetes. When we can give the diagnosis in early stage, really useful for the patient, benefit for them, right? We can treat them better and prevent a complication. That's the things. Okay. Can I move next? Let me change the slide a little bit because you know why I make a mistake. I change like this. It's not continuously, so give me 1 second. Okay, I will replace this another slide. Yes, here. So we come to the next case. Just like switched about the place. Next case we have the case. It's really too long to on the one option, one the slide. So I have to divide 2 slides. So let's start with that. Okay.